Well, thank you very much for the opportunity to talk a little bit about rural water supply sanitation in South Asia. As you know, I actually joined the region quite recently. I've been sector manager for water and urban in the last 4 months. So one of the actually interesting discovery for my new job is to find how much activities we have in this region on rural water supply and sanitation. So this is actually really important part of our engagement with the government in the water sector. And we actually have a lot of good experiences and good results on the ground. I'm glad to talk a bit about it and maybe about some of the future challenges that we have. So again, this rural water and sanitation is very important in this region where even though it's fast urbanizing, there's still a lot of population living in the rural villages, and there's the challenge of expanding water supply, drinking water, and improve the sanitation. It's a big priority actually for most of our governments in the region, and they have given very high priority to the sector, and they have actually made a lot of achievement in terms of expanding the coverage in safe drinking water and improve the sanitation. And the bank has had extensive engagement, as I said, in many countries like India, Bangladesh, Nepal, Sri Lanka. Now, as I discovered, the key challenges we have in this sector is it's not too difficult to build the water system there. The difficulty is to make sure that a few months or several years after you build the system, water will still flow from the system. I think that's the big challenge. And we found, for example, in India, for example, there's a big, the government has been built quite a lot of rural water system there. They've spent very significant funding on this. But you see like 30 to 40% of the schemes, they periodically slip back into what they call the partially covered or not covered states. So you have the cycle, have to build and then rebuild, and after several years you can go back and rebuild. So there are issues of operating maintenance, cost recovery, which affect operating maintenance, and identification of water source quality and quantity. So these are the issues that needs to be addressed to make sure that the rural water supply that's once built, it will be sustainable. So what's good that I think through the bank in the region, we have 20 years of engagement in the region, and we have actually lots of valuable experience accumulated to address these challenges. Our engagement started, for example, in the early 1990s. That's mostly focused on CDD approach. Then in the early 2000s, further strengthening the CDD approach, we have a sort of more focus on the role of local governments, and with a sort of decentralization, so local government-centered schemes, still with a lot of beneficiary community participation, but with local government-centric. And then the latest programs are more focused on the sector-wide approach, so taking the states in India, so statewide, state-level sector-wide approach or district-level sector-wide approach to address sort of the key issue. And also in India, in Bangladesh, we have quite a lot of sort of innovations in getting the private sectors to be involved in water service, and that played an important role not only in improving the service quality, but also in the case, for example, in Bangladesh, the private sector also is bringing private capitals in the investment. So we have a lot of sort of operations. So the key sort of features of this approach, I think we've seen, which to ensure the sustainability, I think there are sort of 4 areas that our projects have been focusing on. The first one is really demand-responsive approach. It's based on the empowerment of beneficiaries in the planning and the management of rural water supply sanitation. So you have supporting organizations, usually NGOs, and they work together with the technical experts in mobilizing communities, and they understand local demands and prepare the communities, involve the communities throughout the preparation of the scheme. That's really very critical to ensure the success. The second area is really focused on cost sharing. At least communities will contribute to the operating maintenance cost, and in some cases also contribute to part of the capital cost. So with this strong sort of cost sharing, actually, for example, we are moving to, in some of the newer projects, moving to 100% metering, and in some cases, like Punjab state in India, we're achieving in villages 24 hours, 7 days continuous water supply in these villages, which in most of our countries, in the urban areas, we haven't achieved yet. The third area of sort of focus is really on the planning of the schemes to address the water quality and the water quantity constraints. So there, again, our technical experts work very closely with the communities in designing schemes that the community desire and are willing to maintain. There's careful attention to the water source sustainability, careful consideration of how to integrate sanitation programs into the water supply schemes, and also in these projects develop the detailed guidelines on planning, implementation, operating, maintenance for different levels of agencies and entities that are involved. And the fourth area in terms of approach, I think it's very important, is to have a clear sort of definition of the roles and the responsibilities of the different levels of governments. For example, in the case of India, the village level local government is fully responsible for village level schemes. They organize, orchestrate the implementation, again with strong beneficiary participation. Then at a higher level, you have district level local governments. They are responsible for multi-village schemes. And the important role of state government that we have been sort of working quite a lot, and the key challenge is to change its role gradually from a direct service provider to a more facilitating role, the facilitating adoption of reforms, building the capacity, providing technical guidance to the lower levels of government and to the communities, rather than as the direct service provider. That changing of role and reform the state government agencies, that's an important part of the program. And then with all these levels of government, you need strong capacity building programs at all these levels. So I think with these approaches, it's actually the results have been pretty good. We have a recent study looking at, for example, in India, the projects that have been completed, and we have reviewers going to the villages looking at them many years after the implementation, after the construction of the system, and we found that close to 90% of the systems are still operating many years after the construction. That is a sort of much higher percentage than the more traditional supply-driven schemes, which you have about 60 or 70% are still operating after many years. So looking forward, I think that the challenges based on the approaches that we have taken and the actually good results that we have got from these different schemes, I think the main challenge for me, I think, is to mainstream these approaches. What's happening is in many of our countries, the bank financed the project, has been using this beneficiary-driven approach, but the government is also spending its own money, have their own schemes on water supply, which has been in most cases a more supply-driven approach. Build, and then you have the issues of build and rebuild, and they are not sustainable. So now in some of the countries, especially in India, we are in the dialogue with the government to see how we may be able to mainstream the approach that's been successful. So with a sort of national program, so have a national program as government's program, probably with some of our funding support, but for this reform of having more beneficiary-driven approach, having a cost recovery, much more emphasis on community involvement and the role of local government. That's the one that we have been discussing with the government, and this reform agenda. It's important, especially as I mentioned before, the role of state agencies, the state public health engineering department, to change their role from direct service providers, constructors, to a facilitating role. That we hope we can make some progress, then to provide a great opportunity to scale up the engagement at a national level. And then I think we also have the challenge of further innovations in terms of our rural water supply and sanitation schemes to address the emerging issues. For example, I think there are growing demand from the rural households for household level connections, not only communal taps, but for household level connections. The demand for improved service quality. Multi-village schemes that would involve sort of different sort of jurisdiction, different villages, but also it's more complicated institutionally. How to scale up sanitation as part of the package, and again, it's not only improve the sanitation but also the quality of sanitation. How to address the complex issues that are faced in the peri-urban areas, which you have both urban features and the rural features, and to do that. And then I think in the programs, we really need to establish and strengthen the monitoring and evaluation systems, which are sort of very important for ensure the sustainability of these works. So these are the further works I think we need to do in terms of further innovation to improve the successful experience we have that we have gained. So main challenge, mainstream the approach, but also further improvement and innovation. So I think there's still quite a lot of work to do in the region for this. That's all I would like to highlight today. Thank you very much.